Good evening, everybody. Thank you for your time and coming here. I think there's a big interest also in this topic, and I appreciate and want to thank the Florida Society of Anesthesiologists and obviously Rosalie as the chair of the Pediatric Anesthesia Committee for allowing us to give a little update regarding the ASA and SPA communication regarding some of the cases that are happening with in pediatrics with some Venezuelan families. I also want to thank Rubena Soccer, chair of Tulane, also Venezuelan, who helped us initially as we were getting information from our colleagues in Venezuelan anesthesiologists across the world who were sending these communications from the other societies and helped us put into communications with ASA. And I want to thank also the chief of our hospital, Raul Fernandez, for obviously helping us and helping me put together this presentation and get a lot of the information that's there. So with that, I'm going to start. Let's see if it wants to. Okay, I have no financial disclosures. Pretty simple. The objective of this short topic or lecture webinar is this is a new topic that's coming out. It's more for information than going into details. I think this is what I hope is the beginning of the spread of information that we all need to gather as pediatric anesthesiologists around the world if we have any chance of encountering this. And the ultimate goal and my objective is for people to be informed so we can make the right decisions in the anesthetic plan and hopefully prevent any other case happening. As I said before, I'm a bias because I'm a pediatric anesthesiologist. I was trained in Venezuela before moving here and did my the anesthesia residency and fellowship here in the US and where I'm practicing currently in Miami. But I'm also a parent and my wife's also from Venezuela. So obviously as a parent, if my child needs anesthesia and we have these scenarios occurring, it's obviously of concern if my kids are at risk. So what do we know? What brought us to this point? We started hearing and sadly experiencing cases of pediatric patients generally healthy with no major significant disorders that were coming for elective procedures. Some of them were outpatients. Their anesthetic records showed no major hemodynamic changes, and the most common drugs were used, the most common typical for a pediatric case where we were talking sevoflurane as a maintenance. Some had propofol, some had fentanyl. What ended up happening is delayed emergence with short cases or sudden neurological deficits that impacted or ended up with the patient dying close thereof or in the few days or weeks after the episode, or if they survive, they encounter severe neurologic injuries and in most radiologic imaging showed as basal ganglia infarct. As this developed, we started gathering information, and the other common finding is they all shared a similar mutation of their mitochondrial DNA that we'll touch soon enough. So for us, at least as far as we can recall, it started all in July of 2025, where the Society of Anesthesiologists from Chile in the Southern Hemisphere in South America. And I have to commend their effort and all their work they have done on this, as they had encountered 5 previously healthy children that had went through the same characteristics, and 4 of them died. So they made this communication, alerting all their society, and with the Ministry of Health, they started requiring reporting of any death that occurred in children that came to the OR and had no significant past medical history, but had this bad outcome, and they wanted to collect more data. Through them, we listened and heard that the Spanish Society of Anesthesia through the group of scientists, they had already had in 2024 6 cases accounted for, and they had a study proposal where they were going to look into this problem associated with Venezuelans. And here you have some information. 6 individuals obviously had the bad outcome, all shared after genetic studying the same mitochondrial DNA mutation that it was a specific of complex 1 of the electron transport chain and affected obviously the oxidative phosphorylation system. Uh, as it says, as it showed the study and their base and their scientific data, it all ended up in neuronal necrosis, particularly of the basal ganglia, which also allowed to put together many of the cases that have been now encountered. They go on to say that initially, as we can all be a skeptic if this is something really happening or not, that the chances of 6 different patients of Venezuelan inheritance at this point, in different cities, in different years, having different types of procedures to have the same bad outcome and sharing the same mitochondrial DNA mutation is less than 1 in 4 quadrillion. So the probability of this being a new rare disease or mutation that makes the patients who have these mutations susceptible to general anesthetics are not independent but are related. Then we had some communications from the Venezuelan Society of Anesthesiologists calling for the attention to these episodes or these cases. And as the Colombian Society of Anesthesia, they always recommend approaching to this new problem with high level of clinical ethics, being responsible, being as scientific as possible. And that's what we want to continue to promote as we continue to wait for more robust research that's being done. Finally, at the end of July, thanks to the ASA and, as I mentioned before, Ruben Azócar, who allowed us to put in contact with SPA and ASA, that they were able to get in a call conference with the Chilean Society of Anesthesia, and they emitted or they put out this communication where we basically don't know much, but we have to be careful and we promote the reporting of it. So what are the facts of this problem? So far, up to date, we have about 25, 26 cases being reported, and these are the countries that have been reported. The first case goes back to 2001 in Germany, where the son of a physician went to get an elective orthopedic procedure and had the neurologic devastation, but did not die. That patient the next year went to the US to have the hardware removed and was given anesthetics with sevoflurane and exposed to sevoflurane, and the neurologic symptoms worsened. So we're talking about 2001, 2002. In 2008, a family member, a cousin of this first patient, also went to have an anesthetic for an unrelated procedure and developed severe neurologic outcomes. Based on this, a physician obviously started looking at this as a possible complication, and they started looking, and this is the first reported abnormal variant of the mitochondrial DNA, but at that time, and as expected, is a first mutation without any knowledge that this could be the beginning or the description of a disease like we're talking today. So we know this is probably the tip of the iceberg. So, and it leaves us with more questions than answers. Now, I believe that in many cases, due to the situation we live and the way this happens, healthy kid comes to the OR, most likely ends up in court or it's in the legal matter. And sometimes the sharing of information is limited just by the whole process. And for us to know and be able to approach the families and discuss this as a possible, or even going back to cases that happened a few years back, can be challenging even to collect new data to see if we can gather more samples to test for the mutation. recently, these are all cases we've had via personal communications in the last 3 months. We've known that in Florida, 3 years ago, a 19-year-old came for elective plastic surgery, led to this outcome. Another case in Florida, another 10-year-old for elective outpatient procedure, same thing. In Utah, we've heard about a toddler that ended up after surgery with severe neurologic sequela, but there's very limited information as far as the DNA testing. We don't know if it even showed anything related to the mitochondria, but other cases being discussed in the US are being limited with the sharing of information. In Spain recently, there was an adult who also had severe outcomes. She did not die, but it's recovering from the neurologic sequela. But the patient, the mother, and the maternal aunts all have been studied and showed the same mitochondrial DNA mutation. What is this DNA mutation in the mitochondria? As we can see, is described as a variation of uncertain significance. Basically, it is described as that in some of these countries. They all have been reported, this mutation in these 3 countries at least. And it's a mutation in the gene, in one of the genes, the ND4, that is one of the 7 genes that is part of the gene that produces the protein that's part of the complex one. Obviously, this affects the electron transport chain and the oxidative phosphorylation. This is a position, and it's basically a one base change from thymine to cyanine. So we're trying to look for more knowledge, and as we create this is where communication and sharing of information among these countries and ourselves, and hopefully gathering the true experts of mitochondrial disorders that can help us, geneticists who can help us guide us in the management of these patients. As we know, in general, volatile anesthetics suppress the oxidative phosphorylation, particularly complex 1, coenzyme Q, and to a lesser extent, complex 5. And here in the image, you can see all or most common anesthetics being used and their different sites of effect. We also know that in the perioperative period, any of our anesthetics may disrupt mitochondrial function by altering, again, the oxidative phosphorylation, increasing the reactive oxygen species and their production, and impairing their mitochondrial dynamics. Some of these, in some of the studies, are being associated with the postoperative cognitive decline that we see in the elder population and any other long-term cognitive outcomes. We know that through the mitochondria, there's some mitochondria-mediated regulated cell death pathways, and some of our anesthetics, sevoflurane, isoflurane, are pro-stimulant of this apoptotic or cell death pathways and can increase the cell death via stimulation. In the yellow arrows in the graph, those are all proven mechanisms and effects of our anesthetics in the lab. The red dots are proposed theories of impact of our anesthetics, but they have not been proven in the lab. And then finally, we know that during the inductions, patients who suffer or have a type of complex 1 dysfunctions are markedly hypersensitive to sevoflurane. So the levels of sevoflurane required to achieve certain BIS or ways of monitoring the EEG or process EEG is less than persons who don't have this complex 1 dysfunction. So again, complicated. There's a lot of data to be studied. What's the future of this? I think that as we collect more data and samples are collected and we can get better information, we will be better assessed and empowered to give more information to our families and patients in order for them to give a more informed consent regarding elective procedures or the risk regarding any procedures. Now, some people refer, some of the specialists who have been dealing with this already for quite a while, they kind of like remember the beginnings of MH, and that maybe this is sort of a disease that started like MH, and now we all are aware and educated about it. There are some other specific mitochondrial DNA mutations that affect many symptoms and body functions, which is what we know of most of our mitochondrial disorders. But this might be a specific pharmacogenomic disease like the ones we've seen. In one good example or analogy that I find is in those patients who have a mitochondrial DNA mutation or variant, the aminoglycosides can lead to ototoxicity, where in those patients who do not have that, they're not at risk when exposed to this medication to have ototoxicity. Maybe this is a disorder that is only at risk when exposed to sevoflurane or any of the inhaled anesthetics as they're being studied. As I said, many other countries, Chile and Spain, are doing functional studies about the mitochondria and the effects of the many drugs as they're trying to answer many of the questions that we probably all have. Is isoflurane, is desflurane the same effect as sevoflurane on the mitochondria? Are we going to have the same outcomes? We don't know. We're waiting for these functional studies and they being published. What we know by preliminary data that some of the Spanish scientists are sharing through the Society of Anesthesia in Spain is that in the lab, the cells or the in vitro test that they did that had the mitochondrial DNA mutation, they found in the functional studies the effects of the reduced production of ATP and energy compared to normal cells or their control group. So maybe there's some information there. At the same time, in this preliminary report that have not been published, they give the basis of why some of these cases or these cases with the concern should be done with propofol, because in the same lab, propofol did not affect the function of the mitochondria when they have this mutation. So again, preliminary data, we're all looking for this. What we also know is by communications, some of these children that did not die and require further surgery, they obviously did not do the case with inhaled anesthetics, and they used propofol without worsening the symptoms or neurologic outcomes. And this leads me to the almost end. Obviously, these are the states where we have more Venezuelans and we could be exposed. So these are obviously, we are all involved in this, and we could potentially be encountering any of these cases, and it's good to be informed. What are in general, sort of what do we think we're recommending is obviously we should continue to do what we do every day in a detailed history and physical exam, looking for any sign and symptoms of any potential mitochondrial disorder, which raises flags. But most of these kids, we know they were healthy and didn't show any signs. And then look at the detailed family history. If there's currently, right now, we know that one of the risk factors or concerns is the maternal family is from Venezuela, or the child is born to a Venezuelan mother. Now, in the future, if this evolves and becomes like MH, the Venezuelan risk factor might not be there in the future. But any positive maternal history of complications, even or history in the patient or any family member of delayed awakening, is something to consider. And then, assuming this is risk factors, probably switching to TIVA. As in Europe and in Chile, they use the target control infusions. We do not have those devices or protocols here in the US, but we can do TIVA, and propofol, as I said before, seems to be safe in these particular cases. Guide your anesthetics with process EEG if you have the capability and the devices, or some recommend even using BIS or perfusion brain tissue saturometry with the INVOS. Always educate the family and your colleagues, which is what I hope we get at least from today's. Take this message to your centers and spread the word. Keep an eye out for these cases. and consider referring patients and family to genetics if it's an elective case. Give them the option of saying, hey, this is happening. Maybe we should delay if there's any concerns before elective procedures. But if there's an urgent or emergent procedure and there's our risk factors when you do and examine the patients, consider doing TIVA and using propofol, dexmedetomidine, or any of the other options. As the ASA recommended, and this is something that we're definitely recommending, is that everybody report to the Quality Institute, and that way we can start getting more robust data about these patients and the events that are happening or are coming out. A shout out to the Society for Pediatric Anesthesia, and always have their PD Crisis app, which is critical for any emergency and allows you to troubleshoot this. Finally, and the last point I want to touch before I finish the presentation is, as we know, these cases are probably for any anesthesiologist, especially pediatric anesthesiologists in general, it's a nightmare. It breaks the whole system. Not only the families get destroyed by the loss of their loved one, a child, but it affects every healthcare member, the surgeon, the anesthesiologist, anybody that's in the OR. This is a bad outcome, and we have to recognize this and be aware of what the second victim syndrome is. Be supportive. The ASA has tremendous amount of information how to support your colleagues or how to look for help if you are struggling after an event like this. So I recommend either keep an eye out for your colleagues or call for help and ask for support whenever it's needed. With that, I want to finish my presentation, and thanks again for the FSA to give us an opportunity to present this for everybody, and a small shout out for next year as we gather again for our FSA annual meeting next June. Thank you very much.
Thank you so much, Luis. That was an excellent review and bringing us up to speed with what's going on. I know this is a fast-moving and changing situation, and I think it has a lot of pieces to it. You know, migration patterns, uh, pharmacology, genetics, anesthesia. I mean, it's got it all. So I know there's going to be more for us to digest. I'm going to go ahead and go to some of the questions, if you don't mind. The first one is for Luis. Do you recommend screening for a Venezuelan family history?
What I would say, and knowing that I'm Venezuelan because my wife and I discussed it, obviously this is a big topic of conversation after the events that we have seen and heard. The problem is, one, it's financial. Genetic testing is not covered here or anywhere by insurances unless you need it. It's simple. You just need a blood draw from yourself or from the interested parties and to look for that. I believe in the US, compared to some of the other countries that have discussed their challenges in getting genetic testing, here in the US, we have a way of getting your complete exome in 24, 48 hours, but it might cost. So that's a problem. Now, again, I think risk factors, it's location based. Whenever I'm talking now to families that are Venezuelan inheritance or family members, or there's any risk factors, I disclose what we know so far. And I tell them we don't know much. This is something that's starting. What I recommend, if it's an elective procedure and you have the capability and you are concerned and you had a family member or you suffer delay awakening, highly consider doing your genetic testing. If you don't have it, if you don't have the capability, then but there are risk factors, as I said before, then you would consider changing and do not expose them to any of the inhaled anesthetics just because you don't want to trigger that.
Thank you. Next question. Uh, do we know of any patients or family members who have been found to have the same mutation that have undergone uneventful sevoflurane general anesthesia?
as far as the other countries who have more data than us, they have not reported those cases. What we can tell you from some of the cases we've experienced and seen is patients who had delayed awakening, but had that was the effect, and then had the anesthesia and developed the neurologic outcomes or sequela. So, as all mitochondrial disorders or genetic disorders, penetrance and variability amongst individuals, especially trying to understand how the mutations inside the DNA of the mitochondria are inherited, and in that sense you can have multiple genes or chromosomes of the mitochondria that are with different variables, and that would explain some of the penetrance where some kids might have had an anesthetic with no complications and suddenly they develop the complication. But there's very limited data on this. But so far, no, we have not encountered family members who have the mutation and had anesthesia without complications. So far, all the patients that had what we know for sure is that all the patients who had a bad outcome had the mutation. We don't know in that were tested. What we don't know is those patients who had the bad outcomes or were never tested if those showed the mutation.
Thank you. I guess there was probably some we don't know what we don't know also. Somebody may have skated through and have a mutation we just don't know because they never had a bad outcome. Possibly. Next question. If a family history of this issue with general anesthesia, if a family history of this issue with general anesthesia is present, can we utilize regional and spinal anesthesia with sedation as an alternative?
If the surgery allows it, it's one of the recommendations. Same for other mitochondrial disorders. You want to take the measures in general that you do. You decrease the stress, decrease the pain, and for that, regional anesthesia is encouraged in those disorders. Decrease the NPO times, measure glucose and other of the stress-related factors that can worsen mitochondrial disorders. But in case if the surgery allows it, sure, I don't think it's a bad idea.
Next question. At a time where we have many families afraid of possible deportation, how do you recommend bringing country of origin into pre-op discussions? The loaded question.
That's why the topic, the title of my presentation makes it a bad outcome in a particular population where we are in strange times. And yes, I think we have to be responsible in the way we approach this and be as professional. You just want to say, look, this is happening. For those of us who live in Miami and are exposed to Spanish speaking from all other countries, you over time can recognize certain accents, but I don't expect anybody to be able to do that. Sometimes even for me, it's hard to differentiate which country they're coming from, even though they're speaking in Spanish. But you can ask as a personal approach is to say first, is there any significant problems in the family? Have there had any delayed awakening? If any of those turns positive, and you can switch the question and saying, by any chance, are you or any fam or the maternal side is from Venezuela, instead of going, are you from Venezuela and you have trouble, you've had complications under anesthesia, you can probably flip it, and that allows you to make an ethical and professional approach to the question of the ethnicity.
Thank you. Do we have an idea of toxic levels of exposure to volatile anesthetics? Do we need to flush the machine or use an MH machine?
That's an excellent question, and I think it comes from Ellen Choi. I wish we could answer. Again, there's very few reports and discussions about it. In the Chilean Society of Anesthesia, they do recommend that when you know about this patient, you actually treat the machine and treat it like with the MH precautions of just purging the system and taking the inhaled anesthetics off the machine. So if you do that and you plan to do TIVA, it could be a safe approach.
Thank you. Is there a way we can get funding for genetic testing in this population so that the financial burden will not stop the families from getting a genetic test? This way we can gather more data and have better recommendations.
So that's the idea in Spain. They open for volunteers to donate their DNA of all the family members or anybody from Venezuela to trying to get an incidence in the population. Their results are still coming up. The proposal for the study was only a year ago, so I'm assuming hopefully we can see that data in the next few years. But if we had any foundation or any researcher who has some funding and is willing to gather this information, that would be an excellent tool for us who provide care of children or anybody in reality from the highly populated states.
Thank you. If the mother is negative for this mutation, will her children be safe?
I would assume so, since we know the mitochondria with the mutation is inherited from the mother. What are the chances of a single mutation in the mitochondria happening de novo and causing this? Can happen, but I would, Rosalie, I think this would be extremely extreme. This is already a rare disease. This would be extremely rare, knowing that this is one of the risk factors we look for.
Sure.
But if you have the gene studies from the mother, I would strongly support the idea of the children are relatively safe. Yeah.
The only thing I don't know is if there was any, if there could be any grand maternal transmission. I don't know the answer to that. I have something skip a generation. I don't know. I don't know the answer to that.
No, we don't. We don't. Obviously, this is 6 months ago. We didn't know anything about this. We didn't even expect this. Cases that this happened weren't even treated as a potential mitochondrial disorder. Is now that we're trying to open those boxes and look into them in detail to see if this is the disorder. And both, I think I see the questions, and let me see. Do you feel confident propofol is safe as several of the affected patients receive propofol? I wish I could give you a black and white answer. Yesterday, the Chilean Society of Anesthesia had a great webinar, and their expert in mitochondrial disorder and their expert geneticist discussed this and said, look, right now, until we have published data with the functional studies showing that propofol does not do anything, we cannot say for certain that this, but based on the experience they've had, that is their path. Knowing that they are using target control infusions and they're using processed EEG to guide their anesthetic levels. So you are maintaining levels and not just throwing a dose and keeping it running throughout prolonged periods. There's
Dr. Stein has asked, do we know if any family members of the victims
propofol potentially implemented as with other mitochondrial disorders? Not sure what implemented is, but I would assume that we can use it safely. So far, in the experience of other countries, they are using it safely, but as I answered before, until the studies show, we cannot say 100% is safe. I'm curious about the original patient from Germany. They have the mutation? Were they originally from South America? From my understanding, yes. It's a dog. It was the son of a Venezuelan physician in Germany at that time, and that's sort of how everything has trickled down. And the suspicion of once a family member had the bad outcome, the thought of this coming from the maternal side and the theory or hypothesis that this could be a mitochondrial disorder inheritance. I have Dr. Barrientos from Chile saying if we can share the slides. Our plan is hopefully the recording will make available. I want to praise again your work in Chile, and they are doing an amazing job in gathering information and sharing information. So from us to you guys over there, I want to thank you for all the information, but we'll do everything. At the end of the slides, you had my email, and I'm happy to share what we can. Mike, from the hypothesis, pediatric age to 20, apparently there are a couple of cases in adults who never had surgery. One of the cases we know for sure there was they had a family member from the paternal maternal side that went for shoulder surgery and had a bad outcome, but that's all we got. We didn't get any more details into it. Does that mean that adults who never had anesthesia can have this? I would assume if the mitochondrial disorder is there and you've never been exposed to the triggering agent, you are at risk. Is there a specific gene test that should be ordered? As I'm not a genetics expert, and if anybody is, but what I understand is when you do a full exome, you are able to get your full genome with the variants and also your mitochondrial DNA with the potential variants. So this is what I think is what is recommended.
And you
Is
did
there a role?
mention the actual gene in one of your slides.
Yes, and the
The
gene
actual
is
gene
important.
mutation is
Yeah.
actually in one of his slides, right?
Yes. So sometimes the one of the geneticists that has spoken about this says that maybe in the future this is going to be something as simple as doing like a COVID test where you swap and you can detect if that mutation is there. I just hope that this is something as simple as that, and they don't have to patients don't have to go like for MH and muscle biopsy, which is extremely expensive and cumbersome. Why are we seeing these events now? Uh, I think is after collecting enough cases and people having the thought to look into this is where this started trickling. As you can imagine, as I said before, nightmare cases like this probably get solved inside a closed room where maybe it's settled as a bad outcome because of anesthesia, but without finding a cause. And then these cases are locked, not to be seen. But hopefully with this, we can start looking back and being able to share a light into this problem. And that's why I think, and that's why I praise the Chilean society that they decided to look at this as something as odd that in 5 years they had 5 cases, and they started to look from the perspective of science and research and trying to find the cause of this. Are there plans to publish a case series of all known cases in high impact journal? I would hope so. I think they're already working on this from the Chilean Society, who have more of the data, and in the Spanish they have collected all this since the beginning and they have all the information. I think that through ASA and SPA and some of us who are interested in this topic, we're trying to also collect data to eventually gather information as those who were involved in those cases and the health systems that were involved in those cases are willing to share their results. What about just is there a role in reporting database in an incidental brain imaging findings for Venezuela children who had an estimate there is a subclinical effect on the basal ganglia? That's not a bad idea. We have not been able to get a lot of information from the Venezuelan Society of Anesthesia. We are just hoping, as I understand, that they're collecting data and hopefully are able or willing to share it with the rest of those of us who are taking care of Venezuelan children and families all over the world.
I think there will probably be, if you were actually looking at this particular answer, there will probably be some crossover with respect to children who have Lee syndrome who also present this way. I mean, sometimes they have uh, neurologic deficit without anesthetic exposure as well. So there may be some crossover with that population, I think, which is also a complex one mitochondrial mutation.
Yeah. What about remimazolam? Any sedative, midazolam, remimazolam, fentanyl, remifentanil, have been used. Dexmedetomidine is being used, especially since our common approach to a pediatric patient is to use inhaled anesthesia and then obtain an IV. Well, this becomes an issue in at-risk patients where you now have to do an IV on an awake patient. And if we have to do it, it's not going to be the first time, it's not going to be the last. We'll do it. But there's tools that we have in our armamentarium of medications that can be used to sedate the patient to make him more cooperative to get IVs and then proceed with your intravenous anesthesia for the case. For the patients who had events, was there a family history of anesthesia problems? Yes and no. We're trying to gather as much information. As I said, the few cases that I've heard from personal experience or communications, one of them had a family history. Others, they don't seem to have much information. So I apologize. I hope that as we collect, again, this is just the beginning. Not a question. You wanted to say thank you for this informative inviting us outside of the FSA to join. Will have a very broad impact. And that's our pleasure. My ultimate goal, if all of us can spread the word and this leads to one patient not suffering this bad outcome and one member of the anesthesia team not being devastated, I think we made our goal. And I just want to hope that this information comes from, we keep doing this and we collect more data and we have, mitochondrial disorder experts, geneticists talking to us about this in the near future. Anonym, that last comment or on the reported event in Venezuela, maybe it's hard to tell. We could even say that it's underreported in the United States because of the way the cases are being managed. So I think nobody was looking at ethnicity or point of origin or some of the mutations, and even this mutation up until recently for the international community, this mutation is considered a variant of uncertain significance. Apparently in the US, this, for the geneticists and their databases, this mutation is already considered a pathogenic variant. So more on that in the near future.
Mario Met writes here, I would be extremely cautious in recommending propofol with any degree of certainty. Propofol is a very strong inhibitor of complex 1, even to a greater extent than inhalation anesthetics. In Dr. Diesgoda's paper, it was concluded that in a patient with a known mitochondrial disorder, propofol may not be the best choice. This is true. They do work, I believe, at different areas of complex 1. So again, this is getting into genetics that I'm going into waters that I don't really know. But I mean, I think that both drugs work at slightly different areas. So definitely a very important thing to consider.
Look forward.
But uh, but there are probably some fine differences that are making this, I think, more visible in patients who are exposed to sevoflurane compared to propofol. At least
Yeah, and
as
it's
we're
a
talking
great
about it.
comment, and we all have that concern. Um, So as some of the colleagues internationally are saying, because of their experience, they feel more comfortable in making this decision. That doesn't mean that it's the one recommended until we see. hopefully the functional studies where they actually use the mitochondrial cells with the mutation and prove that propofol does not have the same impact as sevoflurane and even isoflurane or desflurane. We don't know yet. Then we can say safely like this. But remember, this is a different variant than all the typical mitochondrial disorders. This is a very specific mutation that is only triggered, seems like, with sevoflurane. But thank you for your comment.
But
I think
extremely
it's
important comment for sure. Thank you,
very
William.
important. And we have tools. We have other options that you can use in the meantime.
Do we know if any family members of the victims have been tested? Did we answer that?
As far as we know, the only one that I have personally heard about was a recent case in this year in Spain where the patient, the mother, and the aunts were tested and they all carried the same gene. But again, that's 26 cases so far described. This is one of them. Hopefully, we have more data on this, but keep an eye out for this and keep looking. Look out at what the societies of these countries are saying. I think they're putting all the information out there for all of us to provide the safest care for these patients.
Any known distinguishing factors of those who survived?
I think that the percentage of patients who have survived is very minimal. Out of the 26, probably two or three. But this is I'm not 100% sure. All that we know about is that those patients in Chile, those patients, most of them died. They made the reference that in Europe they might have more cases who have survived. I don't know is the type of penetrance of the disease or the variability of their disorders there, but this is as far as I can recall from their discussions.
Thank you. So, and I want to, again, this is not, I mean, although we do see a high population of Venezuelan people of origin in Florida, this is not a Florida problem. And I do want to thank the Florida Society of Anesthesiologists for allowing everybody, for us to open this up to everybody who wanted to listen and hear a little bit more about this. Um, I want to thank everybody for their time, and if there are no other questions, I'll go ahead and end the webinar. Thank you again.
Thank you very much.